Hey, thank you for watching this video. My name is Dr. Saman Nakarmi, physical therapist, and in this video, I'm going to talk to you guys about lateral epicondylitis or tennis elbow. Lateral epicondylitis is an overused injury. What that really means, it's not something that happens overnight where you lift something heavy and you injure your elbow. So it happens over time where your symptoms is mild at the beginning and then it gets progressively, it gets worse. And it typically happens for people who have to lift things repetitively heavy, like construction workers or people that go to the gym where they have to grip something very hard, use those muscles a lot. As well as people that do office works and where they have to type and use the computer and use the mouse for a long periods of time. What all that will cause is friction between your bone that's right there and the muscles right above it. So whenever we are extending, muscles get activated. So whenever we are typing, whenever you are gripping something, these muscles gets tightened up, and as a result there is a friction between muscles here and the bone underneath, and that over time will causes to inflammation and pain. How do you know if you have tennis elbow? First of all, chances are it's always going to be on the dominant arm. So for me, it's going to be on the right side. Okay, it's a little atypical for me to have that problem on the left side unless I constantly perform those activities where I really use my left hand more than my dominant arm. Okay, second, my grip is going to be super painful. So if I were to pick something up, especially if my elbow is all the way extended, if I pick it up, if I have to do something like that, that's going to be painful. Opening a really jar of pickle or something like that, that's going to be painful. Okay, pain is located right there and you can almost pinpoint it. Okay, so you can be touching all the way here, no problem. As soon as you kind of go towards the outside of the elbow, come just a little down and start kind of pushing on it, you'll be like, oh yeah, that's the spot. Okay, there are quite a few, 3 or 4 muscles that can be typically injured, so this general area is going to be extremely sensitive to touch. You also frequently wake up at night because of elbow pain and you feel like you need to really straighten this elbow out, and you kind of have to stretch it out a little bit. Okay, so those are some signs, some symptoms that will let you know if you have tennis elbow. To confirm if you have lateral epicondylitis or not, you can do 2 special tests or confirmation test. Okay, the first one is called Mills test, and all you're going to do is put your arms in this position, and then you are going to use the opposite arm to palpate or feel the area that is injured, and you're going to gently push on it, and then you're going to bend your wrist backwards, and then you should feel a sudden jolt of pain. The second test that you could do to confirm if you have tennis elbow, you kind of need to find yourself a desk or chair or something, and all you're going to do is make sure your wrist is outside the desk. Okay, you're going to bend your wrist this way up, and then you're going to pull it towards your body in this fashion. Okay, you're going to use the opposite arm to kind of push the wrist down, and you're going to hold it, hold it, and if you have pain in your affected elbow, then chances are you have tennis elbow. However, you kind of have to look at the big picture. Okay, so you have to match those pains with signs and symptoms. So pain right there, waking you up at night, difficulty with gripping, type of work you do. You have to factor in all those conditions, because special test by itself doesn't really mean anything. Okay, so factor those, and if everything else kind of sounds familiar, chances are you may have lateral epicondylitis. Now, before we move on, you also have to make sure we rule a couple of things out, especially the neck. So you move your neck in all directions. Okay, and if doing those causes any kind of pain, so if there is pain in the elbow with movement on the neck, or if you have a general neck pain, or you feel like there's some shooting pain going down from the neck to the elbow, chances are you may have what you call a cervical radiculopathy. Basically your neck causing your elbow pain, and that topic is a little outside the scope of this video, but let's assume that these are all negative and your pain is just right there, and let's see what we can do to really treat that pain. Okay, now we're going to do some soft tissue work. Okay, you will need a Vaseline or anything that you can apply to that area, and the goal of this is not necessarily that this is going to help you with the pain or something, but this is just to make sure that you're not rubbing against your dry skin. Okay, So what you're going to do, and I think I put a little bit excessive lotion in the heat at the moment, and you don't really need to do that. But first we're going to kind of start with some what you call a gentle massage, okay? You're just going to massage that apply to that area for 15 20 seconds or even 30 to 45 seconds, especially if you are in the beginning stage and you kind of want to give it a decent massage in all area, okay? And the goal of this is just to warm up that area. It shouldn't be fast, it shouldn't be aggressive, okay? So if you are done about 45 seconds to a minute, what you're going to do, you're going to be just a little bit more aggressive and you are going to push towards the area of injuries, okay? So from here to here, okay? Never the opposite way where you're doing this way. You are just going to pull the muscle that you have injured. So you don't want to pull down, you want to push up to that area. Make sure you get the whole lateral side or outside, okay? And then you're going to go a little bit more aggressive, about maybe 10 to 15 times. Don't get too aggressive, okay? Especially if this is your first time trying it. Okay? And finally, what you're going to do, you are then going to go again. So we kind of went parallel to the muscle just right now, and now you're going to go more perpendicular in this way. Just kind of big motions still, relatively gentle pressure throughout, and you should be seeing this tissue right now getting red, which is okay. That just means it's getting warm. That just means it's kind of getting more blood supply. And if you can notice, I'm doing a little bit more specific stuff now, where I am just kind of focusing towards the injured muscle, and I'm still going perpendicular to those muscle fibers in this direction. So maybe for a minute or two. And then what you're going to do after you're done with that, you are going to be a little bit more pinpoint. So you're going to put your fingers like that, and you are just kind of going to gently rub that spot. That's kind of called a cross friction massage. And you're not going to like dig into it, just maybe a light pressure, and you're kind of going to rub it in and hold like that for about 15-20 seconds in the same spot. Move again to the other side, try to dig in and find the other spot. 15-20 seconds on the other spot, okay? Just like that. And then you're going to do that for a couple of times in a couple of spots. You kind of want to keep rubbing it in this fashion. Kind of helps to relax the muscle a little bit. And the final one, you're going to go what you call a J stroke. So you're going to find a point of pain. Say for example, if it's this one, I'm going to go just a little bit lower than that, and I'm going to make what you call a J. Okay? You want to avoid using your thumb, so don't do stuff like that, because that's kind of going to hurt your thumb, and now you will need physical therapy for your thumb. So you kind of want to keep like this type of grip, and then you want to keep your fingers just a little bent, okay? And you are going to do that for about 15-20 seconds. Now this is going to be the most aggressive of all, and it's going to hurt. So if this is your first time doing, maybe just do 2-3 repetitions, and then kind of do a little bit more next day if you need to. And obviously you are going to end with a general massage again, okay? Again, never this way. You're just going to pull that muscle that is injured. You're going to push towards the source of injury. Okay, maybe for 15 to 10 seconds. And that's what I do for soft tissue massage for people or patients that have lateral epicondylitis, and this usually helps to relax those muscles. So let's follow it up with some exercise, but before that, let's wipe this up. Now after we have done some hands-on work, you have relieved the pain a little bit, it's time to do some exercise. And just a general rule of thumb. Okay, the exercises should not be painful. No pain, no gain. Typically only applies for muscle burn when you work out, not necessarily for physical therapy. Okay, it shouldn't be causing unnecessarily joint and muscle pain that you are experiencing. All right. Now, if you have pain while doing things like opening the jar or something like that, then you want to take it a little easy on these exercises. Okay, so we'll start with the most gentle one. You're going to put your wrist back again in the same position. You're going to put the opposite arm right on top, and you're going to gently push against the other arm, giving some isometric resistance. You are going to hold for about 5 seconds or so. Relax. And do it again, where you're going to pushing up. So if the hand wasn't holding you in this direction, you should be doing this. But just apply a light pressure on that. You should be feeling this muscle working and kicking in a little bit. All these exercises now should be in a pain-free region. Okay, don't push through pain. Don't push through pain. Okay. Again. Okay. You're going to do that about 10 times. Now, if this exercise is too easy or if it doesn't cause any pain, you're going to grab yourself some weights, very lighter weights, 2-3 pounds, or a can of soup if you don't have any dumbbells or nothing. You're going to put that in the same position. So what you're going to focus on is what you call an eccentric portion of the exercise, so basically lowering the weight. So you're going to curl the weight up like that, and what you're going to be slow and careful is lowering the weight. So maybe 5 or 6 seconds on the way down. So up and slow on the way down. Up and slow on the way down. And you're going to do that 10 times. Now, if you have a resistance band or a TheraBand, you can also do that. Okay, and if gripping something hurts, you can always tie the resistance band like this, and that will help you with the grip too. Okay, and then you don't really have to grip the TheraBand. So same thing, we're going to go up and down slowly. One more time, up and down slowly. The down slowly part is more important than anything else here. After that, you are just going to do some stretches, okay? You're just going to do a gentle stretch. Again, the key word being gentle. This way, hold for 30 seconds, and then you're going to gently stretch like this for 30 seconds, okay? Now, for this, when it comes to stretch, I always like to say if 0 is no stretch and the 10 is maximum stretch that you can experience, the stretch needs to be around 3 or so 3 to 4. You don't want to really stretch out the muscle too much that it's injured, okay? Again, 3 to 4 out of 10. 0 is no stretch, 10 is the extreme stretch. Okay. Next exercise we'll do is what you call a pronation and supination. Now, if you're in the beginning stage, you can just put your hands like this position again, and you're just going to turn the palms in and turn the palms out. And this may be enough for you, but if it is not, grab yourself any kind of tool, stick, whatever. Hammer works best. I couldn't find my hammer, so I'm going to show you with this. And you are just going to go to the same motion, but now you have a little resistance on it, okay? And you don't want to have a death grip on this one, okay? So you kind of want to have a light grip. You should be feeling stretch on these towards the end. Only go to the range of motion that you can. So if you can go from here to here, that's perfectly fine, okay? You don't want to go push through pain and go fast, okay? So very slow and controlled. Okay, and if this is too hard, you can obviously grab it more towards the weight, and that makes it a little bit easier. Okay, hammer again. Hammer works better. Just couldn't find my hammer, so I'm just using this tool right here that we have. Okay, doesn't really matter what you grab. Okay, slow and controlled. And repeat for about 10 times or so total. For the last two exercises, you will need a band like this. Now, it doesn't have to be this specific band. Any band will do. You can buy with Amazon, but what I recommend is get the ones with the variety pack where you can progress your resistance based on, the stage you are in, okay? So what you need to do is you need to tie a band, sorry, not buy a band, you do need to buy a band, but tie a band somewhere in between your end of your ribs right here to the beginning of the waist, okay? Somewhere between those two, doesn't have to be too specific. And what you're going to do is you're going to squeeze your shoulder blades together, you're going to pull the band, squeeze your shoulder, hold for a second or two, and relax. Pull the band, hold for a second or two, relax. Now, if gripping really hurts, in which it may, you don't have to really make a death grip and hold things like that, okay? You can make a claw grip, and you can hold down to it like that, okay? And you can do your rows like this, okay? And the next exercise is going to be what you call your shoulder extension, and you're still going to be in the same position. And what you're going to do, squeeze the shoulder blade again, and for the rows, you are bending your shoulders the elbows like this. Now for your extension, you're just going to keep your elbows straight and pull it down, okay? Now this, if it's too difficult, like for me it is, you're just going to make sure you change to a easier band, or in my case, I can, instead of a double loop, I can make a single loop like that. Helps. I can even tie it in like this so that I don't have to use my grip too much. And squeeze your shoulder blade again, and you can pull and hold for a second or two. Pull, hold for a second or two, okay? If even doing this hurts your grip or hurts your elbow, then what you can do is you can invest yourself in a wrist strap. So you can invest in a wrist strap that looks like this. This is an ankle strap, but it works for your wrist as well. And what you're going to do, you are going to tie the wrist strap, and you can do the same exercise like that. Squeeze your shoulder blade, okay? Or you could do this one, okay? So you can also do exercise in the gym, such as your bicep curl. You could do your lat pull downs. You can do your lateral raises, stuff like that. Pretty much anything where you require to grip. If you put the wrist straps instead, you'll really spare overusing this muscle, which you need to do if you want this muscle to heal. Let's talk about TENS, ice, and heat. Okay, so in the clinic, we typically use ice along with TENS unit to treat this condition. It has shown to be very successful in temporarily relieving pain. So it's not a permanent solution, but it will give you relief for a couple of hours, okay? And what we have done is we have put on the TENS unit. That's the one that sends electricity on your skin and kind of gets the muscles pumping, and will help you with the pain, and it tends to work better with ice to treat this condition. Now, if you do not have a TENS unit, you can either purchase one at home, or if you don't want to invest in something like that, then you can alternate between ice and heat. What you want to do is you want to run hot water on your forearm, but you have to make sure that it's not so hot that you burn yourself, obviously, and then you immediately follow by cold. So what you do is you run your forearm with hot water for about 30 seconds, and you follow it up with running cold water. Now, as hot as you can tolerate and as cold as you can tolerate, 30 seconds each bout, okay? And that gives a similar effect to TENS unit. If not, TENS unit is also a better idea, especially because you can use your TENS unit along with the ice, after you're done, when you're driving, when you are, resting, stuff like that, okay? Now let's talk about brace for tennis elbow. So the one that I like to use is one of these that has like a bubble, and that's what's going to offload your muscle. Or what you could do is you can use a wrist brace for tennis elbow. And the wrist brace for tennis elbow, I don't have it at home, but you put your wrist in this angle so that it offloads your muscle, okay? But the one that I like and I've seen success with my patients is the one with the bubble. So all you do, it's not complicated, all you do is you make sure that bubble part is on that muscle that's hurting. It needs to be snug, not super tight. And you put it on, and that's it. Okay. Now this is, again, a brace is just going to be a temporary relief, just like your tens and ice and stuff like that. This is not really meant to be a crutch, so you shouldn't be permanently be dependent on it for months or years. Okay, so it's typically for someone who, whose profession is, construction and or typing and stuff like that, and they really cannot say, oh, hey, I don't want to work. So that kind of helps you, gives a temporary relief, but try not to be too dependent on it. It has worked about 70% of my patients, and for 30 this doesn't seem to help, but it doesn't really hurt to give it a try. Okay, now you can do your ice, your TENS, your heat, your ultrasound, your massage, or any other modalities, and that's going to help you with the pain, but it's not really going to help you in the long term if you don't follow these up with exercise. Okay, because exercise is the king, and exercise really helps to strengthen those tendons, those muscles and ligaments that are inflamed. You just don't want to overdo it, but you want to progressively make your exercises more difficult. Okay, so exercise is number one. These are some things I have tried with my patients and have treated their condition, tennis elbow, very successfully. I hope these techniques help you as well. I hope you liked this video. If you did, please make sure you hit the like button. Please subscribe to my channel. More contents on physical therapy coming soon. Until then, take care. Bye-bye.